Severe maternal morbidity, or SMM, is characterized by unexpected adverse outcomes of labor and delivery for a person giving birth. SMM encompasses 16 life-threatening conditions, such as eclampsia, renal failure, and sepsis, and 5 life-saving procedures, including hysterectomy and ventilation. Some preventable cases of SMM have underlying causes, like high blood pressure, that can be identified for intervention early on, but if left untreated, they can evolve into cases of severe morbidity or even death. For birthing people in Massachusetts, severe maternal morbidity far outnumbers maternal deaths, with fewer than 10 pregnancy-related deaths per year compared to over 800 episodes of severe morbidity. In fact, Massachusetts has among the highest rates of severe maternal morbidity in the U.S., despite performing well on all other measures of reproductive care and women's health. It's well documented that people of color are much more likely to experience severe maternal morbidity. To better understand how racial and ethnic disparities contribute to the problem of SMM in Massachusetts, the Health Policy Commission identified labor and delivery stays and postpartum hospitalizations with severe morbidity at Massachusetts hospitals. Between 2019 and 2022, Black non-Hispanic patients experienced 242 episodes of SMM per 10,000 delivery and postpartum hospitalizations, by far the highest rate in the Commonwealth and 2.5 times higher than the rate among white non-Hispanic patients. This disparity persisted regardless of community income level. Previous research has shown that racism, including structural, cultural, and individual discrimination, is a main driver of adverse health outcomes. The stress of racial discrimination can also directly influence physical health, leading to the accelerated aging or weathering of bodies over time. A survey conducted by the Massachusetts Department of Public Health showed that birthing people of color reported more instances of racism and were more likely to experience racism-related stress before delivery compared to their white non-Hispanic counterparts. Knowing that maternal health inequities persist in the Commonwealth, the HPC next wanted to understand if there were implications for spending and affordability associated with severe maternal morbidity. The HPC found that maternity care for patients with SMM was almost twice as costly as care for patients without SMM. Care received by Black non-Hispanic patients with SMM was the most costly on average, totaling over $50,000 in spending, with over $2,000 in cost sharing. Not only are Black non-Hispanic patients more likely to experience severe morbidity, they also pay more for this care. Policy solutions that target both clinical and social drivers of severe maternal morbidity will more equitably address the issue in Massachusetts. The Commonwealth recently passed legislation to expand access to midwifery, doula, and mental health services, while the Hilley-Driscoll administration has outlined a statewide initiative to eliminate racial, economic, and regional disparities in maternal health outcomes. Additionally, the HPC is investing in innovative, cost-effective care delivery models to identify and treat clinical precursors to severe morbidity. Together, these efforts offer new opportunities to advance prevention and improve outcomes for pregnant and postpartum people in Massachusetts.